Craving is an intense and an unbearable urge to take a particular substance of abuse or to engage in a particular behavior which the person is addicted to. So why does craving happen? When a person is addicted to a particular substance or a behavior, there are a lot of associated conditions and situations with respect to that substance which forms different kind of connections in the brain. To give an example, if a person had a habit of drinking alcohol and he would have peanuts when he would have alcohol, he would have alcohol while having non-veg food, or he would have alcohol when he would be with his friends playing carom, then when each of these situations would occur, the person would have an intense urge to consume alcohol because of the associated situation with respect to drinking. So the person might have an urge each time he would see peanuts. He might have an urge when he would see someone else drinking. He might have an urge when he sees his friends playing carom. He might have an urge while even walking down the road, which has a wine shop from where he used to take alcohol. Craving typically can also happen because of your underlying issues for which you were taking the particular substance. So for example, if a person had a habit of smoking when he felt lonely or when he felt stressed or when he had anxiety, then these same situations can also trigger an intense urge to smoke when a person is trying to stay away from smoking. So how do we deal with craving? Craving typically, when it happens, lasts for a very specific amount of time, ranging generally for a few minutes to half an hour. And it is specifically triggered by these situations. So when a person wants to learn how to deal with his craving, one has to recognize the different triggers that might be making a person turn towards that particular substance. So just like we discussed now, there might be the specific behaviors and situations which a person has to identify, which might make him or her turn towards a very strong kind of a craving to take that particular substance. Then a mental plan will be required as to how to deal with these individual situations. For example, if a person has an urge to smoke when he feels lonely in a very particular time of the day, he might require being amongst people, being busy in that particular point of time. He might require to use some kind of distraction techniques, engaging with people, doing some activity, so that once that time has passed, then the craving settles down. If the person has underlying issues, then these will have to be naturally dealt with so that the craving then doesn't happen. There are some medication options that are also available for craving of different substances, which can help in reducing that urge to consume that particular substance. Also, for underlying depression, anxiety or sleep related issues, you might need to also discuss with your mental health professional so that these can be treated, so that once you are better and your depression or anxiety is under control, you might not feel the urge to seek the substance to deal with the underlying issues.